Our next guest, Dr. Hershey, I think I met in 2015, somewhere thereabouts, when she, maybe even before that, I can't remember, but you lectured for us as well at a different conference or with us, and my internet connection is unstable. That's not good. Okay, so Dr. Hershey, though, I'm going to just read a little bit about who she is. So she's won numerous awards for her research on inhalation chemotherapy and vaccine sarcomas in cats, and has been included in the Manchester Who's Who among executives and professionals for her professional accolades and achievements. She has authored and co-authored multiple publications, including several book chapters. Dr. Hershey is a member of the Veterinary Cancer Society, the American Veterinary Medical Association, the Arizona Veterinary Medical Association. You might figure out where she's from with that one. The American Association of Traditional Chinese Veterinary Medicine, and you will not figure out where she's from with that one. You're not from China, right? The American Academy of Veterinary Acupuncture and the American Holistic Veterinary Medical Association. She lives with her 2 children, an entourage of dogs, cats, rabbits, pigs, tortoises, and horses. Lots of animals, it sounds like. It sounds like a zoo over there. So hopefully this lecture, you're able to keep that under control so we can hear you speaking and not all of the animals in the background. But integrative oncologist, that's a very rare combination. So we're excited to hear from you. With that said, I'm just going to turn it over to you now.
Hi, thank you. If I can do this.
Perfect.
All right, that works.
Awesome.
Hi, everybody. Very glad to be here. My story is very similar to everybody else. I am a conventionally trained medical oncologist. Back when I graduated from veterinary school and did my residency training, there weren't many opportunities to learn alternative therapies in the veterinary school or in the veterinary training. Oops, this is very sensitive. So, of course, I get out into clinical practice, and I've been trained to basically cut, burn, and poison, as we like to say. And I thought the same thing, is that all there is? There must be something more I can do. I too, don't like telling my clients that there's nothing more we can do. Sometimes there's nothing more we should do. Sometimes there's nothing more that conventional medicine can offer, but that doesn't mean that the pet can't live a good life or have more time or have an improvement in their quality of life. And so that's how I got into many of the things that I do. I'm an acupuncturist, Chinese herbal medicine therapy. We have a hyperbaric chamber as well. We do ozone therapy. And Jonathan, I believe I met you in 2012 at Dr. Schallenberger's course, if you were there. And then we also have a hyperbaric chamber. So we do lots of adjunctive therapies. I still do a lot of chemotherapy. I'm not a radiation oncologist, but we certainly have one in the city that we refer to. We do a lot of immunotherapy. I like to do surgery. I do my own surgery as well. We're going to talk about how I have incorporated ozone therapy into my oncology practice. So we've had some very nice talks today about the mechanism of action of ozone. I'm going to touch a little bit upon cancer and hypoxia, because hypoxia is a big problem in cancer medicine and something that's very difficult to overcome and can certainly lead to more aggressive tumor phenotypes and can result in resistance to chemotherapy and radiation therapy as well. But many solid tumors contain areas of acute or chronic hypoxia, and the severity of hypoxia can vary both within and among the different tumor types. And tumor cells are very good at adapting and becoming resistant to therapies, and they can certainly adapt to that hypoxic microenvironment, which can allow those tumor cells to survive and proliferate even in such a hostile environment. And hypoxia can lead to a more aggressive tumor phenotype, which can lead to tumor progression, as well as metastasis and resistance to therapy. Hypoxia has been suggested as a negative prognostic factor for patient outcome in some human cancers, and that's actually independent of the standard factors we usually look at, such as tumor stage, nodal status, and evidence of metastatic disease. And studies in humans have suggested that there is worse disease-free survival time for patients with hypoxic cervical cancers, soft tissue sarcoma, and some head and neck cancers as well. So the question is, can we overcome or at least improve upon that hypoxic environment with ozone, hyperbaric oxygen therapy, and other oxygen therapies. And I've been doing a literature search because I think it's interesting to see what's out in the human field. Certainly we need to publish our work as veterinarians, and I'm guilty as anybody else. I have myself overscheduled and I never have time to do any writing. This particular study looked at ozone therapy for tumor oxygenation. It was a pilot study. So 18 human patients were treated with the technique autohemotransfusion on 3 alternate days over a period of 1 week. And then tumor oxygen levels were measured via needle probes into the tumor before and after the first and third ozone sessions. And so the conclusion from these researchers is that ozone therapy can in fact improve oxygenation even in the most hypoxic tumors. The bigger question is, will that result in improvement in treatment outcomes? So what's the role of ozone's use in cancer? So when I did the literature search, I came upon quite a number of studies looking at ozone as an adjunct to address chemotherapy or radiation side effects or the symptoms of cancer. And that's probably where a lot of us use it. There's also some indication, of course, that it has anti-cancer effect, but there's much less in the literature regarding that particular aspect of ozone therapy. And certainly most of those, I think, as Zach had indicated earlier, is that they're in vitro studies and not necessarily in vivo studies, and certainly not clinical trials with actual patients with spontaneous tumors. So one study that was published, and these are relatively recent studies. I like to go through literature searches periodically because there's just been an explosion of scientific published articles in the ozone field. If you look 5 years ago, not much available. Many of these articles are within the last 5 years. But this particular study looked at 50 patients with cancer that were suffering from cancer-related fatigue. And these were patients treated in a clinic in Italy. They were treated with autohemotransfusion twice a week for 1 month, and then twice monthly as maintenance therapy. It's really nice to see when we look at these human studies that, because there's not always a lot to go on when we're making up our ozone protocols, which is very nice that we have these conferences that we can share what we're doing. But it's very nice to look at this and be like, that's pretty much what I do too. So I'm glad I'm following some kind of standard protocol. But these particular patients, 19 patients were currently undergoing cancer therapy. 10 patients had completed their cancer therapy, and 21 patients were receiving palliative care. And the patients were evaluated based on what's known as the fatigue severity scale. So there's some objective means of measuring these patients' fatigue. And 70% of the patients treated with ozone had greater than 50% improvement in their symptoms. I think that's pretty terrific. So another study looked at the effect of ozonated olive oil for the prevention and treatment of sorafenib-induced hand-foot skin reactions. And this was a randomized controlled trial. Sorafenib is a targeted chemotherapy drug that's used to treat people with advanced and non-resectable hepatocellular carcinoma. We are starting to do some use of the sorafenib in dogs. There has been a clinical trial, so we have a dose established. I have a couple of patients on the sorafenib. Can't say I've seen any hand-foot skin reactions, but we certainly know that we don't necessarily see the same reactions in dogs and cats that we do in people. And typically, patients that have this hand-foot skin reaction are treated with a urea ointment. So they studied 99 patients with hepatocellular carcinoma treated with sorafenib and divided them into two groups. One group that received the medical ozone ointment and one group that received the urea ointment, which at that point was the standard of care. And the conclusions were that the ozone ointment significantly reduced the occurrence and severity of hand-foot skin reactions in these patients, and it did it better than the standard of care urea. So perhaps it will become the standard of care. Another study looked at refractory pelvic pain syndromes secondary to cancer treatment. So a lot of patients that have radiation therapy in the pelvic region can have refractory pain even after treatment has been completed. And so 6 patients were studied with refractory pelvic pain after cancer therapy was completed, and they were treated with either intravesical or rectal insufflation of ozone. And all patients but one experienced a significant reduction of pain. So the author's conclusion was that ozone was beneficial in reducing pelvic pain after unsuccessful conventional therapy. So of course, these patients were refractory. They had other conventional therapies that didn't work for them, but the ozone did in all but one. And then these are just some other articles that I found. I didn't want to take up too much time talking about the articles because I want to talk about our clinical treatments. But there was an article on ozone gel for osteoradionecrosis treatment, post-radiation therapy, very common side effect of radiation therapy, especially of the jaw. Ozone nanobubble water for chemotherapy-related stomatitis. We've all been talking about using the ozonated rinses for dental procedures. It works great for feline stomatitis. Rectal insufflation or topical oil for the management of radiation-induced persistent rectal bleeding in prostate cancer patients. And then there was also an article I found about the application of ozonated water. This happens to be a case report. So this particular person had a very extensive surgery and radiation therapy for an esophageal squamous cell carcinoma. And as a result of that therapy, developed a very large gastrothoracic fistula and went through a lot of treatments that didn't work until the ozonated water. And that person actually healed up the fistula after multiple failed attempts with conventional therapy. So looking at ozone's use as a possible adjunct to conventional cancer therapies, and I certainly do that a lot. We have a lot of patients that are undergoing conventional cancer therapies, including chemotherapy and surgery that we're doing ozone on as well. This particular was a rat model. And of course, that's what I found when I went out to literature. I couldn't find any actual clinical trials specifically looking at this. We always joke and say, if you're a mouse or a rat, we can take good care of you. Doesn't always translate into what happens in veterinary medicine or people for that matter. But this was still an interesting study looking at a combination of radiation therapy and ozone on tumoral tissue and survival in a rat model of tongue cancer. So they were using radiation therapy and the ozone application in combination. And they showed that both histopathologic improvement was noted, as well as a prolonged survival time in the rats in the group that received the combination. So they actually had a group that had no treatment, one that had just radiation therapy, one that had just the ozone, and then of course the combination. So anti-cancer effect, certainly believe that we've got an anti-cancer effect. Again, this is an in vitro study, but this particular study showed that medical ozone induces proliferation and migration inhibition through ROS accumulation in this pathway, suppression in human liver cancer cells. So they concluded that the ozone treatment inhibited the liver cancer cell growth and colony formation, and it also induced G2M cell cycle arrest. Great study. Hopefully it'll translate into clinical work. So in our clinic, there's a number of different ways, and if you guys are doing ozone, you're probably familiar with many of these ways, but I'll just talk to you how I use them in the cancer patients. We do some major autohemotherapy with or without the ultraviolet light irradiation. I will tell you that I probably don't do major autohemotherapy alone anymore, simply because I think the combination of the autohemotherapy with the ultraviolet light irradiation is better and much more powerful. The other advantage is it doesn't take as long to infuse back into the patient. So with the major autohemotherapy, once we collect the blood and ozonate it, takes a couple of hours to get that back into the patient, where when we do combine it with the ultraviolet light irradiation, it's about a 15-minute infusion process once everything is set up and ready to go. We do a lot of minor autohemotherapy. 25% of my practice are non-cancer patients coming for the alternative therapies that we provide. So I see a fair number of skin cases. They're not my favorite, yet my favorite at the same time. I think skin is very hard in conventional medicine, but I've had a lot of success with Chinese herbal therapy, and the patients that are refractory to food therapy and Chinese medicine, we'll do the minor autohemotherapy with, and they have tremendous results and comfort improved with that. We probably do most commonly rectal insufflation, simply because of the ease of administration. It's cost effective. It doesn't take a lot of time. I do some intravesical insufflation, i.e. into the bladder. And I'll show you a case in the next couple of slides. I typically tend to use that most commonly with cyclophosamide induced cystitis. I don't see that much anymore with the use of Lasix, but we do occasionally see that. And it works very well. It works better than anything out there conventional. And I also do direct IV. I know that is controversial. And I was not taught that in Frank Schallenberger's class when I took his class back in 2012. But I do remember being in that first meeting in 2015, and a lot of the European and South American MDs rave about it. And so I started doing it, and it's a little scary at times, but we've done it successfully. It's probably one of my favorite ways to do it, again, because it doesn't take a lot of time, doesn't take a lot of equipment, and it's cost effective for the owner. And we also use topical ozonated olive oil as well. So this is one of our protocol sheets. So we have protocol sheets. I'm an oncologist. I have protocols for everything, including my ozone. So this is our major autochemotherapy treatment. So we just record the patient and the weight for that date, of course. And then we calculate the total blood volume of the patient, 85 mils per kilogram. And then we calculate how much blood we're going to draw from that patient. So when I'm doing the major autochemotherapy, we do draw more blood. It's usually somewhere between 5 to 10%. Usually it's on the lower side. I don't draw more than 10% from the patient. We add our calcium stock solution, glutathione, and then the ozone. We do use the ozone at 45 gamma. That's how I was taught, and or I guess what I interpreted from Dr. Schallenberger's class, and that has worked very well for us for this technique. So we've continued to do that. And then based on how quickly I want to get it into the patient, I give the technicians a rate, and then they write down the start of the transfusion, the completion of transfusion. Again, because I'm an oncologist, everything is double, if not triple checked. So the initials beside it is that now I calculate the total blood volume of the patient, and as well as the blood to be drawn. But somebody comes along and checks me, and then the technician drawing up calcium stock solution and glutathione, as well as the ozone, is checked by another person as well. So we place an IV catheter, of course, and heparinize the catheter. I typically use a dose of heparin of 500 units per kilogram, and dilute that 1 to 5 with saline. And we place half in the patient catheter after it's placed in the patient, and the other half goes in the blood collection bag. When we first started, get all excited, come back from the class, and like, we're going to do this. And we tried a bunch of different techniques. We, tried hooking the blood collection bag and having it on the floor with gravity. And in the end, it turns out my techs just prefer to draw it directly out of the patient. It's a lot easier to do, takes less time. Usually if the pet is cooperative, only one technician is needed to draw the blood, especially a dog. If a cat, forget it, we'll have to have 2 people. But some of our compliant dogs, we can have them in a kennel, and only one person, once the catheter is placed, only one person needs to be available to draw the blood. And then we place our blood in the blood collection bag. Depending on how much volume of blood you're taking and how good a bleeder that patient is, it can take you 15 minutes to collect all that blood. And I've had it take us as long as an hour, but most of the time we can collect the blood in about 15 to 30 minutes. We do have a port on our ozone generator. So we pull up the ozone in a separate syringe, and then that's added to the blood collection bag. We do again use the ozone at 45 gamma. The blood and ozone mixture is gently rocked back and forth for 30 to 60 seconds. And then we hook them up, and off they go. And these guys are in a treatment room, so there's somebody available at all times. Nobody leaves the treatment room if a patient is hooked up to an IV, whether that's ozone or IV fluids. So if we're adding the ultraviolet light irradiation, again, most of my patients, if we're doing major autochemotherapy, are also getting the ultraviolet light. So we take a lot less blood from the patient. The most we'll ever take, even in a large breed dog, is 60 mils. We scale down for smaller animals. So a small cat might be about 10 mLs. I've taken in a kitten about 5 mLs. And then if I'm taking a total of 60 mLs of blood from the patient, then that's placed in a 150 ml bag of saline. But I'll scale down as well. So I'm not going to run that much into a 3-pound kitten by any means. We do add the ozone at 45 gamma. It's given at the amount of ozone is the same volume of blood. And then that blood and saline mixture goes through the ultraviolet light cuvette and is administered within 15 minutes to the patient. And we have a similar sheet for our major autochemotherapy UBI. It just, again, scales down from 60 cc's to smaller, depending on the size of the patient. You can see this one is filled out. So this was, you can see the technician's initials. Now this was back in 2014. So you can see how practices evolve. We probably weren't seconding each other at that point, but that has changed. And so now there would be 2 initials beside that. And this is a dog that I did very early in my ozone training. So this was probably the first dog that we did when we come back from training. And this is Sheamus. Sheamus was a young beagle at the time. He was 6 years old, and he was owned by some organic farmers in town. And he was diagnosed with immune-mediated thrombocytopenia, and the owners didn't want to do prednisone or any heavy drugs. So we did the ozone UBI for him, and he had a great response. His platelets normalized. He went back to a good quality of life. We probably did it weekly for about 6 weeks, and then we did it every 2 weeks for about 4 treatments, and then we did it monthly for a while. And then after a while, he was doing so well, he would only come in about every 6 months when the owner felt that he was not doing as well. And he lived, I think he was 6 when we started his treatment. He lived to be 16. This is a little cat by the name of Lost. He's one of our current patients that we perform the major autohemotherapy ultraviolet light irradiation. He actually has feline leukemia virus. And so I found, can't really check, I guess, their viral load, so to speak, but I will tell you I've treated distemper puppies where you can actually quantify the viral load in those dogs, and they will fall dramatically after ozone treatment. And we have had several dogs, including one that is in my own pack of those, that pack that Jonathan said that survived distemper. It works really well for those dogs. They'll still have some neurologic signs if they present with neurologic signs. So those don't always go away, but the patient will survive in many cases. So this is another case that I did very early in my training. And this is Izzy. She belonged to one of the emergency technicians, and she was diagnosed at age 3 via bone aspirate with osteosarcoma. And the owner did not want to amputate or do any sort of conventional therapy. So we elected to try ozone therapy. And at that time, we did just the major autohemotherapy. We also injected ozone directly around the area of the tumor in her bone. We treated her weekly for 8 weeks, then every 2 weeks for 6 treatments, and then we treated her monthly. This is Izzy's bone when we first started. So very classic, very classic lesions for osteosarcoma, for that starburst appearance on her distal femur. So this was probably, I would say, maybe 8 to 12 weeks after the start of ozone. So she still has a little bit of proliferation, periosteal proliferation, but much improved. And this was Izzy after that. So we didn't go back and re-aspirate, of course, or re-biopsy her, but she was clinically sound, felt great. And other than what we think was just, this was residual. So this never changed for a long time, but the rest of the bone has healed. And she had a complete regression of tumor radiographically. So that was about 6 months, took 6 months to completely regress on radiograph. Some periosteal scarring remains. She remained in clinical remission for 4 years after diagnosis. We did continue maintenance ozone therapy after 6 months, about every 2 to 3 months. She ultimately was euthanized due to lung metastasis. But I will tell you, 4 years is pretty remarkable for osteosarcoma. Even with amputation and chemotherapy, we get about a year, 2 years if you're lucky. The minor autohemotherapy, we inject a small volume of blood. We all know this, so we probably don't have to go over the details, but I use it predominantly with my skin allergy cases that are refractory to other therapies. We do collect urine for most of these patients. We can either collect it via cystocentesis, so sometimes we'll do it that way. We do have some owners that just free catch it and bring it into the clinic with them. So we will collect the urine first. So if we're doing it by cysto, we'll collect the urine first, or if it's free catch, we'll have it drawn up into our syringe. Generally collect 2 cc's of ozone. I'll have the technicians draw up the ozone into a syringe, usually a 5 cc syringe. And then we'll typically just draw the blood with a butterfly catheter directly into the ozone. So most of the time we use the jugular. We do use the peripheral leg veins as well. Depends on the patient. And then once we have that ozone blood mixture, then we add the urine to it. We rock the mixture back and forth for about 30 seconds. We expel the ozone gas, and then we inject it into the lumbar muscle of the patient. We typically use a 22 gauge needle. I typically, for skin allergy cases, I will treat them once per week for 4 weeks, and then every 2 weeks for 4 treatments, and then we go monthly. I've had a number of dogs where after a period of time, we were able to stop the treatment and they went 6 months, a year or longer without needing additional treatments. But I have had some patients that do come back as they flare, and we complete another series.
We've got about we've got about 4 minutes here.
Okay, that's okay. We're getting there. So this is Lily. She has an acanthomatous ameloblastoma. She also has skin allergy, so she's a current patient that's receiving minor autohemotherapy. Her tumor's been stable in her mouth for about 10 months, and her allergies have been pretty well controlled. So rectal insufflation, most common way that I do it. I typically do it about 20 gamma, although if I'm doing microbiome restorative therapy, I go much higher than that. We typically will just draw it up into a syringe, insert the catheter. And a lot of times if it's a large breed dog, especially this dog's an elderly dog and he can't stand for long periods of time. So my technicians will lay him down on some blankets and let him lay laterally while they infuse the ozone. And then we'll just tuck his tail and sit with him for about 10 minutes before we send them home. Typically, before curbside service, would do this in the exam room with the owner and then let them sit for 10 minutes while we finished up paperwork. This one I want to talk about quickly, as I really like this particular technique for cyclophosamide-induced cystitis. That can be extraordinarily painful to the dog. And there's not a lot of conventional treatments that work. You can certainly put them on nonsteroidals. There are articles about DMSO and even formaldehyde installation into the bladder. But I will tell you, ozone works great. This is our what we call the anti-inflammatory solutions, basically propane and B vitamins. I honestly don't do that anymore. I just stick straight ozone gas into the bladder. Typically for these cystitis dogs, if you were treating them conventionally, I would tell the owners it could take months for it to resolve. It's basically time heals and you try and palliate the pain. Typically with ozone, one treatment will do the trick. I've had a few patients that I had to do a second treatment a week later, but that's typically all it takes to resolve the signs of the cystitis. Very, very easy to do. I just use ultrasound guidance and like I'm doing a cysto, and I put the ozone in bladder. And there you can just see the ultrasound. You can see the ozone coming out into the bladder. So I just want to talk a little bit about direct IV ozone. I do know it's controversial. Again, I was not taught that in Dr. Schallenberger's class, and I learned it at the inaugural ozone conference in 2015. I know there's concern about potential fatal thromboembolism. And I think in one of the previous lecturers, there's been several deaths reported. But why would I do it then if it's controversial and potentially comes with complications? Because it's easy to do. It's not very time consuming. You don't need a whole lot of fancy supplies. So I don't need blood collection bags. I don't need an ozone cuvette. It's very cost effective. So we don't charge a whole lot for this technique compared to our autohemotherapy techniques, our major autohemotherapy techniques. I don't know what I'm not sure what the appropriate dose is, but what I have sort of done over time, which seems to work pretty well, is I'm dosing them roughly at 1 to 2 mils of ozone per 10 pounds of body weight. And I typically use a fairly low gamma with them. So I'm using somewhere between 11 to 20 gamma. And I do this technique. I will not let my technicians do this technique simply because if there's a problem, I will be the one to blame. I have not had a problem though. So the key is to give it slowly, depending on the volume. I probably infuse this into the patient over about 3 to 10 minutes. So if I have a 1 mil in a cat, I'm probably going to infuse it, 3 to 5 minutes. Some of the larger volume dogs I'll do over about 10 minutes. We monitor the patient. So a technician is holding that patient while I'm giving. Often found that the respirations will often increase to some degree during the infusion. They're not dyspneic, they're not cyanotic, but they do start to have a little bit higher respiratory rate. And we monitor the color. When we first started doing it, I had a few patients. I just suspect I gave it too fast, and maybe this is the euphoria that the dogs experience. Excuse me, because we did see a couple of dogs, and they were larger dogs. They got a little bit woozy. Their head started to bobble a little bit, and they looked almost like they were going to pass out. So we just stopped the infusion, gave them a few minutes. They recovered. We finished the infusion at a slower rate, and they did absolutely fine. I do monitor those patients for a good 10 to 15 minutes before we discharge them to the owners, which means that a technician actually literally sits in front of their kennel and watches them to make sure that we don't have any complications. And so this is Esme Pember. She's a current patient undergoing direct IV ozone. So basically, I need a syringe full of ozone. And of course, we just have it sitting in our little Elasticon holder. Syringe with saline and my butterfly syringe, of course, our scrub and our bandage. So very, very easy to do, doesn't take a lot of supplies. And that's all I have. I just threw this slide up because as I was going through my literature search for cancer, I came upon ozone and COVID-19 publication, and this was just published in February 2021. But it, I think somebody already covered this, is that when ozone was added to the standard of care therapy, greatly improved clinical symptoms and rapidly reduced the viral load compared to standard of care therapy alone, facilitating early recovery. So we need to do that more. That's all I have.
Well, thank you very, very much for your time, Dr. Hershey, and your expertise. Now we're, like the other session, is going to transition into a Q&A time. So I've got a few questions, I believe, online already, and we can go to those. But Olivia, can you get ready with that mic here? And if you have a question in the room, just raise your hand right now, and we'll pass the mic to you as well, so we're ready to do that. So give me just a quick second, and we can jump into those. Okay, let's see, man. I have to decide where the last lecture question stopped and where yours start. All right. Chat is now enabled, by the way, those of you online. That chat is enabled, but again, if you have a question, put it in the Q&A section. Okay, so Dr. Hershey, you add glutathione to the same bag as the ozone-infused blood in your major autohemotherapy treatments. Is that true?
Yes, we used to, but honestly, we don't anymore. We just use the calcium stock solution and not the glutathione.
Okay.
I think part of it is that we've had trouble trying to find it.
Okay. Okay, well, thank you for that clarification. And what is the dose of glutathione? So this maybe isn't pertinent anymore since maybe you're not doing that, but what is the dose of glutathione that you add to the MAH, or again?
I think it was a standard dose that we added. I'll have to look at my... Sorry, the dose on my sheet is 1 milligram per cc of blood.
Okay. All right. And did we have a question in here? Let's move to that one if we can.
I basically just wanted to go back over the osteosarcoma, just for the frequency of treatments. I think I missed some of that.
Oh, sure. Could I share this? Let me share the slides again. I can go back to that. Sorry, I took my shirt off.
Yeah, you sure can if you, I believe, if you pull that up.
Let me reshare. Okay, let's see if I can.
And that's a good thing.
I'm sure a lot of the other veterinarians who do ozone, and now of course, we all talk to each other and we can develop protocols. But even when I learned back in 2012, I take the information home from the human class, and I'm like, how am I going to apply this to my dog patients? How often am I going to treat them? How am I going to charge for it? And how often do I do it? And when will I know it's working? And that sort of thing. Mm-hmm. And I still ask those same questions. Sorry, I'm trying to find my case here. Oh, sorry, here's the. So it looks like. So we treated her weekly for 8 weeks. And then we did it every 2 weeks for 6 treatments. And then we did it monthly, I believe, until about 6 to 8 months, until clinical regression. And then we did it every 2 to 3 months as maintenance after that. And we did it up until the time she developed lung metastases and was euthanized.
Great. Does that answer the question there, Jessica? Okay. So another question from Dr. Leary online. She says, I'm unfamiliar with minor autohemotherapy that includes urine. What is the reasoning for that, and what are the indications?
Okay, so my rudimentary understanding, and this I learned again in Frank Schellenberger's class, is that we're trying to, and I use it predominantly for chronic skin allergies. So my understanding is that the antigen-antibody complexes of the things that the dog is sensitive to or reacting to are going to be concentrated in urine and the blood. So if you mix those together with the ozone, you'll get a better response. And they actually do this technique in people as well. Only people bring their first morning urine in when they come in for the technique. And then they mix the person's urine with the blood and do the same technique. So I kind of adapted it, I guess, from humans.
Okay, great. And then kind of a follow-up question to that, Cindy online asks, is the urine-blood combo painful for your patients as it is for mine? If not, I must be doing something wrong.
I don't think so. I don't think it's any more painful than any other IM injection, but I will tell you, and I didn't have time because we were running out of time, the little dog that I showed you, that little Frenchie with the acanthomatous ameloblastoma, and we do these IM injections, and I don't, just like anything else, I mean, I don't prep for an Adapon injection. I don't prep for a hydromorphone pre-anesthetic injection. So, I mean, we're certainly using sterile syringes and sterile needles, but we're not necessarily scrubbing at all or shaving the hair, and we just injected IM. And I've never had a problem until Lily came along, and Lily has abscessed twice. So the first time she abscessed, and the owner and I talked about it, we elected to shave her, shave a small window and do a sterile prep for the next injection. That one went fine. So we continued to do that. And about 3 times after that, she abscessed again on the opposite side. And I'm not sure why. We even sent off a urine for culture, although in theory, the ozone should have killed anything in the urine, but we sent a urine off for culture. Urine was sterile. So we have just eliminated the urine for her because I'm afraid to continue to abscess her. But I don't know why she did that. I had a pit bull years ago. I still see her, who her skin disease, her allergies and her pruritus worsened after she had the urine blood combination. And we ended up eliminating the urine from hers as well. And she does fine with just the blood ozone combination. So I mean, we joked that she was allergic to her own pee. I don't know if that's possible, but those are the only 2 cases I've ever had a problem with.
Good. Anybody here in the room have a question? Maybe I can.
Where do you inject the urine blood combination for the minor autoimmune therapy for the skin disease? Like, do you put in acupuncture points or?
No, I just do the entire, because it's really only 1 ml of blood and 1 ml of urine. We draw it up into the ozone, and then after about a minute we expel the ozone gas and just give the blood urine combination. So we're just injecting 2 mLs, and I prefer to do it in the epaxial muscles, and we just rotate the sides. So those dogs usually are coming in like once a week for 4 weeks, and then every 2 weeks for 4 treatments. So we're just rotating what side we inject them with. But I just inject them in the epaxial muscles, like lumbar area.
Okay. Yeah, we have one over here.
So have you used a different technique to treat allergies as well that was a different modality of introducing ozone, and that modality didn't work, like something like if you use saline injections subcutaneously, or is this just something that you learned, like you said, from the human side, and that you just went with it as the primary source, or do you have kind of a comparison of different approaches?
I'm sorry, can you repeat the question? I'm not sure I understand what you're asking.
So basically I'm saying, like, have you found that this modality of introducing ozone for allergies is paramount to others, or is this kind of just the one that you were taught that works the best and you just stuck with it because you've seen results?
In terms of, and I'm sorry, my computer cut out. So are you talking about the minor autochemotherapy?
Yeah, correct, exactly. Like comparing it to, like, if you were doing sub-Q saline injections once a week for 4 weeks, et cetera, like, have you seen just that this has been the most successful approach, or are there or is this just kind of like what you were taught from the human side, and this is what they use? So this has been kind of like what you
Gotcha.
have found
Just
results?
just in controlling the symptoms of their allergies, like reducing the pruritus and that sort of thing. So.
Right. Yeah. I guess like, do you have like, basically, did you choose this one because you found that it works better than the others, or is this kind of like what they do in the humans? So that's, how you kind of adopted it.
Yeah, I guess because this is the technique I think they specifically are using for allergic skin disease in humans, or at least what I was taught in Dr. Schellenberger's class. And I guess I've just had, I believe I see it work really well. So I guess I've been continuing that. I will tell you that I don't necessarily reach for ozone as my first line for treating skin allergy cases. I typically, and of course, like most of us that do holistic stuff, I'm seeing these skin allergy cases when Western medicine has failed and the dermatologists have failed and the owners are frustrated because this has been going on for 8 years and they're really hard cases to manage. But my initial approach is food therapy and Chinese herbal medicine. And then if that doesn't work, because I've had a few cases refractory to that, or if it helps but not enough, then I will add in the ozone therapy as well. Did I answer your question?
Okay, so let's see. We have a couple more minutes here, and I have a few more questions online. This comes from Luana, have you used ozone for transitional cell carcinomas in the bladder?
Like as my primary treatment, just infusing it into the bladder?
That was all the question was, so.
Okay. So, and the answer is no, I don't do that routinely. And I guess part of it is that if it were a male dog and I could catheterize the dog to get the ozone in there, then yes, I think it would be interesting to do. But if it's a female dog, the dog would have to be anesthetized to catheterize them. And because transitional cell carcinomas tend to seed the needle track, which is why we don't like doing percutaneous aspirates of transitional cell carcinomas, I wouldn't want to be sticking a needle with, and syringe with ozone percutaneously through the abdominal wall and through the bladder on a regular basis. So that's probably a lot of the reason why I haven't done it.
Okay, thank you. And then this comes from Dr. Broadfoot. Can you limb bag an osteosarc to reduce pain?
I think you could. I haven't done it, to be honest, but that would be interesting to try for sure.
Okay, good. Are you injecting these in acupuncture points is another question. I think you answered that already with the...
Yeah, that was the minor autohemotherapy. No, I do not. I'm just doing an IM injection, so I'm not necessarily doing it in an acupuncture point, although that would be, worthwhile to consider, I suppose. But it's just, I'm just doing 2 mLs once, so.
Okay. And then Dr. Rubin asks, do you use alpha lipoic acid? And if so, what dose and why?
I do not.
Okay, so that answers, that's
So I don't know the
easy.
dose.
That was helpful.
I know.
Okay. So dosing-wise, an ml of blood and 1 ml of urine and 5 mLs of ozone gas, and then just inject a liquid, or what is the dose there when you do that particular injection?
So we're asking again, the minor autohemotherapy, the dosing?
Yep.
Is that am I understanding? I'm sorry, it's hard to hear, even though my speakers are turned up to 100, it's very hard to hear when you're asking the question. So are we just talking through the dosing of the minor autohemotherapy again?
Yes, so just the basically how much gas, how much blood, how much urine.
Yeah, let me pull that slide up. Again. Yeah, so I typically will do 1 cc of blood to about 2 cc's of ozone, and then 1 cc of urine. And then, so how I do that is we collect the urine first. So either the owner brings it in free catch, or my techs walk the dog and free catch it. Or if they won't pee for us, then we'll get it by cystocentesis. So we'll have the urine collected first. and then we'll draw up the ozone. And typically we're drawing up 2 cc's of ozone. I typically start around 45 gamma, but I've gone higher than that in some patients. And then we actually draw the 1 ml of blood directly into the 2 cc of ozone. So we'll take the ozone syringe, and that's why it's a 5 cc syringe, because I'm gonna add my blood and my urine directly to that same syringe. So we'll add the 1 cc of blood directly into the 2 cc of ozone. So we're taking that blood with a butterfly catheter just hooked onto the syringe. Once we have the blood volume, then we take the syringe with the urine in it and put it in the syringe with the blood and the ozone. And then we actually just cap it off, and we just kind of rock it back and forth. So we just kind of agitate it for about 30 to 60 seconds. And then once we do that, then the ozone gas is actually expelled. So you really only have 2 cc's of fluid that you're injecting into the dog, into the muscle.
Okay. Okay, perfect. So this is turning from an ozone conference into a urine conference, guys, and I did not intend that. So no, I'm kidding. So did we have one more? I think we had one more follow-up question, and then we're going to have to transition away from our Q&A time into our breakout group time. So go ahead, one more here.
For the 5 cc syringe that you use for the minor autohuman therapy, what brand of the 5 cc syringe do you use so that it doesn't degrade the rubber part?
God, I'd have to go and look, but it's such a quick process that we haven't had an issue with that. I mean, we literally draw up the blood, put the urine in, and give it to the dog, all within, depending on how hard the dog is to get blood from. I mean, that's all done in less than 5 minutes.
Yeah, and also when you have blood, ozone is absorbed into the blood, so it doesn't react with anything.